Good to see you this afternoon. Thanks for talking to us.
No problem.
It's a huge target, isn't it? 1 million jabs a day. The Health Secretary has said that it's the NHS that will deliver it under his watch. Is it achievable?
We've got to believe it's achievable, I think, and I believe that all NHS workers will pull out all the stops to make it deliverable. But as others have said, that is potentially going to have a real knock-on effect, both to those staff, but also, sadly, to patients who need the health service and social care services for other reasons too. So it's a really big target. It's probably an achievable one, but it will have a really significant impact on many, many things.
Yeah, nobody will ever question the dedication of NHS staff. And as you said, they will pull out all the stops, but you hinted at it there. At what cost? What's going to have to fall by the wayside? Because some tough choices are coming.
Absolutely, and those tough choices will be for the government and NHS leaders to make about exactly working with clinicians, I would hope, to decide exactly what is and what isn't going to be affected by this decision, to essentially redirect lots and lots of staff time and resource into delivering this vaccination programme. It's great to see that there's a real call out for more volunteers to really pick up some of this work. But the exhausted workforce within the NHS, and including those that have been vaccinating now for quite some time, will also be thinking, how am I going to do this? What is it that I'm going to need to do to really help deliver this, but mindful of the impact it's going to be on other people?
Yeah, it's the ramping up of the jabs, but it's also the ramping up of the infrastructure that we saw when vaccinations initially got off the ground in the UK. It's going to take a while for that to come back to full capacity, to the levels we saw when the first vaccines were given out. You mentioned their volunteers. I got a text from a friend of mine who said she's pulling back on her vaccination T-shirt. She's going to work this week. We've got the military coming in to help as well, some 750 personnel. Tell us how all those factors will be working to support NHS staff.
It will all come together to do what the NHS did really, really well, both at the beginning of this programme and throughout the vaccination programme as it's morphed through the different stages. The infrastructure is massive, and I think it will be quite different this time because we're talking about lots more walk-ins, much more unpredictable than planned, booked phases of people booking their appointments a week, 2 weeks in advance. So it's likely to be quite honest, more chaotic than it was, though it will still deliver. But the volunteers, people who had maybe stepped back, I'm sure many will look to step forward again. But as I say, the core group of staff that are going to need to pull all of this infrastructure back together and oversee this massive programme through GPs, through the mass vaccination centres, through all those walk-in centres, pop-ups, etc., is all going to be pulling resource from what they've been doing over the last few months, which has been getting the NHS back to full strength.
And Patricia, I was reading comments from your Chief Executive, Pat Cullen, that said the rapid spread of this new variant means that the expansion of the booster programme is the right thing to do. Further on in those comments, though, it said, however, we are concerned about the scale and pace of this expansion, given these same nurses are already facing huge demands, which we've touched on. And Pat Cullen says this is why the government must be prepared to take every step needed to slow the spread. Do you think there's been enough discussion about further restrictions? We saw some come in last week, but do you think that is part of the fight as well, alongside this booster programme?
Well, that is for SAGE, JCVI, all of those committees who've got a lot more of the data and the evidence to really consider and advise the government. The critical thing is that the government listens to all of the various scientific, medical, clinical, health experts, on psychological experts on what is the best way to really try to manage this at the moment. And it may be that there is a need for more conversation within government and within those scientific circles to decide what other steps may be necessary now or in the near future to control it. The issue that we've got is it's still an unknown. It's very clear from all the evidence, the medical evidence, the scientific evidence, that at the moment people are trying to weigh up just how dangerous. We know how transmissible it is, but what we don't know is how dangerous it's going to be. But what we also know is our NHS and social services are already full to capacity. They're already doing as much as they can do. So even a slight increase on the pressure because of COVID will have a really, really significant impact on NHS and social services. And that's what needs to be avoided. They will fall over at some point if we're not careful.
OK, Patricia Marquis, Director for England at the Royal College of Nursing. Really good to talk to you this afternoon. Thank you so much for taking the time.
Thank you.
Yeah, such a busy time for NHS staff as that booster programme ramps up. We'll be talking about it throughout the afternoon here on Sky News. 1 million jabs a day is going to be needed if